It's really hard to be able to tell you what I do on a day-to-day basis because everything that I do is very dependent on every individual day, and it's so different each day. What we know is that the construction industry are more likely to be smokers, they're more likely to be heavy drinkers, they're less likely to eat well and be active. Basically my role is therefore to work within this industry and looking to improve the health and well-being of the workforce. I get the opportunity to work with these companies in a very tailored approach depending on what they identify as their big health concerns. This could be going out onto site and talking with their staff, but it could also be helping them with their policies and procedures around health and well-being. It could also be helping them to design programs or awareness campaigns. The other things that I would do is that I also work quite closely with our training branch, which is called Civil Train. So I'll go in and I will do education sessions with the students that we've got coming through who are learning how to get the skills and qualifications. So I would say go in and do a talk with them around being sun smart, hydration levels, avoiding heat exhaustion, which obviously are really important in an industry that is basically completely outdoors. What I really love about what I do is to really express to them how much health is so important within our lives. You know, by doing simple steps at work, that you can actually really see some really great outcomes, both for your individual staff, but also as your company culture. And so I've had stories of people coming back and saying that they've seen improvements in the weight of various employees, but also reducing workplace injuries. We've seen better morale and staff retention as well. And then those individual stories of individuals coming up to me and letting me know that since I came out and spoke with them, that they've quit smoking or they've cut down their drinking or that they've signed up to do a fun run for the first time in 20 years. That's the stuff that gives you the warm fuzzies that I really enjoy. Graduated from Flinders Uni at the end of 2011 with a double degree in health science and education, majoring in health promotion and middle and secondary teaching. So in 2012 I started working with OPAL, which was Obesity Prevention and Lifestyle. I was first based with the Salisbury Council, which was my first big girl job, and I absolutely loved it the entire time that I was there. And I went to work with UniSA, based out at their Whyalla campus. So I was based with the Department of Rural Health for about 18 months, but then position here came up. You know, I've been here since February, so about 10 months now, and I've loved every moment of it. I am really passionate about helping people, and I also hate blood. And so I knew that I wanted to be able to help people, but I was never going to be the type to clean up someone's vomit. And so I felt that the best way for me to do that would be to prevent people from becoming sick in the first place. And so health promotion, I think, is so vital because there are obviously a lot of people out there whose diseases can be avoided, and so the ability to then be able to work with people, to educate, to better promote, to create environments that keep them healthy means that for those people that then end up in our hospital system, that we hopefully can be seen sooner because we've been able to successfully keep the majority of the population healthy. So for me, I think it's all about that, and I really enjoy interacting with people, so that's why I love what I do.